Well, good day, everybody. It's KT here, of course, Country 103, and I have the pleasure of having Nicolas Smit in studio with me. Good morning. How are you?
I'm doing great. Thank you for having me.
Well, and you know what? A lot of people are probably going, Nicolas Smit. I've never heard that name on country music radio. Well, Nick is not a country musician by any means, but sort of some local roots. Live in Sudbury. You have a camp here on Manitoulin, long-standing Manitoulin roots, right?
Absolutely, since 69.
Well, yeah, that is fairly long-standing indeed, and welcome. And, you know, Nick brings with him a very lengthy resume, a far too lengthy resume for me to even begin to cite all that you have under your belt. But one of the things that you are known as is you are an international expert in the field of respiratory protection strategies for public health emergencies. Now, you've worked with several governments, including our own provincial as well as federal governments, and south of the border as well, have you not?
Yes, when I was working with the U.S. government, I would be working with the White House. I'd be working with both the Senate and the House as well, so politicians from both sides, because I believe bipartisanship was important. And I also worked with CDC officials and officials from other agencies. And I was even hand-selected to be part of President Biden's task force called POAM 23, which was dedicated to coming up with the next generation strategies for biological threats, including deadly viruses.
Yeah, of course, this all is a result of COVID and the world that we lived in at that point in time. And what Nick's whole sort of mandate is around is, of course, PPE protection as it relates to masking particularly, not only in the healthcare industries, but certainly for wildland firefighters, particularly who are themselves in a very dangerous, precarious situation as it relates to their health.
Absolutely. And when it comes to firefighters, wildfire smoke presents the greatest occupational threat to firefighters. 86% of their fatalities is cancer caused by the wildfire smoke. The next leading cause of death is cardiac disease, and the third is lung disease. But one thing that's often ignored is PTSD among firefighters, which occurs at the same rate as soldiers returning from active duty. Mm-hmm. And when it comes to even the public, the threat of wildfire smoke poses the greatest public health threat to the public, with Statistics Canada believing that it costs up to $21 billion per year for taxpayers to deal with the public health issues related to wildfire smoke.
Well, and we know, obviously, you know, we see that the level of wildfires that are happening more frequent, much larger, you know, from province to province to province, and they are very significant. You know, we saw what happened in the town of Jasper, for example, and certainly what's happening in Manitoba and Saskatchewan right now, and certainly northern part of Ontario. Wildfires are very significant, and you know, we have a lot of young men and women that are on the ground, and sometimes without the proper protection.
Absolutely, and the wildfires we have now are different than they were 10 years ago. Not only are they more frequent and greater in size, but they're also burning a lot more infrastructure. So we're going to see like we saw with Jasper, vehicles being burned, old buildings being burned. So that includes things like asbestos being released into the air, lead from lead paint, and many other issues. So the threat in our air is much greater than it was 10 years ago.
And so as someone who's focused their life and their educational journey on this path in terms of better respirators for, you know, a lot of our emergency personnel, and obviously in the case of pandemic situations and our healthcare, what has that path taken you on, Nick? What does that look like for you now? What have you found to be a better solution?
Well, when it comes to both wildfire smoke and deadly viruses, there's one really overlooked solution in Canada. It's called the elastomeric respirator. Colloquially, it's also known as a P100 respirator because it typically uses P100 respirators. You can find these at your local hardware stores, your paint stores, your big box stores. And what they look like is, you see them on shows like Breaking Bad, where it's a respirator with two filters on the side. Sometimes it covers the eyes, which is called a full face elastomeric respirator, and sometimes it just covers half the face, which is what you'll often see in towns like Sudbury, where, you know, thousands of workers at single sites such as a smelter might be using them. And how it compares to an N95 is they're both approved by the same agency in the US called NIOSH. And compared to an N95, an elastomeric respirator will provide a much better seal. So while an N95 will leave you vulnerable and it will break the seal during quick head movements, if you're using it for more than a couple hours, if you're reusing it, an elastomeric respirator is designed to be reused for years. It's never supposed to ever lose its seal. It's also designed for high heat environments like the ones our firefighters find themselves in, and even outdoor workers find themselves in the summer. And it's also much more cost effective and better for the environment as well. When you're, for example, looking at replacing N95s in healthcare setting, it could replace thousands of N95s per year, and it could significantly reduce the cost. In the US, the CDC found it could reduce the cost by over 95% in the first month of use alone compared to N95, and it's going to be more comfortable. So workers are more likely to want to use it and will also feel more protected, and there's going to be less breathing resistance as well. So it's going to be there. It's a win-win for everybody using it, but it's not really well known, and it's definitely not well understood even within our government.
And so for someone like yourself who, is advocating obviously for a better healthcare, better opportunity for healthcare workers and firefighters to have better protection, how do you go about that? Like, what does that look like for you? And, I'm sure you're meeting with a lot of folks and spending a lot of time talking about this very thing.
Well, it's definitely changed over the years. At first, I would be working with my local MPs and MPPs to get the government to originally look into it. Back in April of 2020, my local NDP, MPP health critic confirmed in the news that the province found that elastomeric respirators would fully protect healthcare workers while surgical masks couldn't. But they were saying that the government, when they were doing research, they weren't sure how it would protect patients. So because they were more concerned about patients than they were about workers getting infected, they decided to tell the healthcare workers and the public they were too dangerous to use, even though they had been officially approved by Ontario Health at that time. And then in May of 2020 by Health Canada. And when it comes to protection levels as well, that's a major difference between N95 and an elastomeric respirator, is an N95 is rated to filter out just 95% of the air particles, including viruses, but a P100 is rated to filter 100% or 99.997. So an easy way to understand the difference would be to compare gas mileage. If your focus is on gas mileage or protection, you would be going from a 100-kilometer range with an N95 to being able to travel 15,000 kilometers with something like an elastomeric respirator. So you could, instead of going from let's say one side of Toronto to the other for work, you can travel from one side of Canada, and that's the difference in protection. It's not just a small difference, it's a significant difference. And when it comes to wildfire smoke, it's an even greater difference, because right now there are no protections against gases being used by firefighters in Canada. The policy is officially stated by Ontario Health and Health Canada are that respirators cannot filter wildfire smoke gases, but these elastomeric respirators can filter out not only gases and organic vapors, but they do a much better job with particulates. So firefighters exposed to, for example, things like benzene and formaldehyde, which are not only irritants but also well known to be carcinogens, it will help eliminate their exposure to these hazards as well.
Well, and I would think, I'm just sitting here thinking about people who work in woodworking. People who are working in concrete, that are cutting concrete, or where the dust particulates off of tile and those kinds of things. I would assume, a mask like this would obviously significantly increase their health chances.
Absolutely. And that's why Health Canada and provinces actually ban the use of N95s for exposure to particulates such as asbestos, and they mandate elastomeric respirators. The government knows the significant difference, and that's why there's many hazards in the workplace where N95s are completely banned, because they know they have significant liabilities, where elastomeric respirators just don't have those liabilities. They're reliable and they provide constant protection.
And so for folks, if you're wondering, when Nick talks about an elastomeric respirator, it's the kind that looks a bit like a gas mask, and it has the filters on it, right? So it looks a little bit like a beetle mask. That's what I always think about when I try to sort of talk about it. But the thing that changes, the mask stays the same, but it's the filters, right?
Yes, the filters do change. Like, for example, if you're looking for protection from particulates, all you need is a P100 filter. It's when you're looking at other hazards in the air, such as gases and organic vapors, that you might be looking at different filters. But there is a wide difference between types of elastomeric respirators as well. Some are made of rubber, some are made of silicone. The silicone, for example, would make a big difference because it would be more malleable, more comfortable, designed for higher heat environments. And it also will provide a much better seal as well. And then manufacturers might have differences. So some manufacturers might put a speech diaphragm in the respirator to make it easier to communicate.
Oh, of course.
Some have wider openings for the inhalation-exhalation valves, which improves breathing resistance, which further improves things like the reduction for heat stress and dehydration. And that's another thing as well. sometimes when you're looking at wildfire smoke also has other effects such as causing heat stress and dehydration. And when you can eliminate a lot of the irritants in the wildfire smoke, you eliminate your chance of getting heat stress and dehydration as well.
And, when you look at that, I know last week you had opportunity to be a keynote speaker at a ASTM educational symposium on wildfire smoke, respiratory protections for firefighters. My apologies. How do you help to sort of push that mandate forward? How do you help to create that educational piece so people really understand how important this is?
So that's twofold. So one part is education. So with the educational symposium, I was able to let the public, including the firefighting community, know these solutions existed. There's other presenters that discussed how provinces including Alberta and BC, started using elastomeric respirators with P100 multi-gas and organic vapor filters in 2023. And they said their findings found that the firefighters were not only more comfortable wearing them, they also felt far more protective. And then there's also presenters from the US discussing how they've been testing different models of PAPRs and elastomeric respirators as well, and how it looks like we're going to be getting rid of N95s for wildfire smoke and moving exclusively to reusable options, just because the significant difference. And in the US, in 2022, the Department of Homeland Security and a few other agencies released a resource guide saying that if wildland firefighters use N95s, they're putting their lives at risk, and they have to absolutely make the transition to elastomeric respirators or PAPRs with these multi-gas filters. And they provided an example of probably well over a dozen different manufacturers that had them available and just a few of the options they have available. And then they described the different features that make them more suitable for that specific model for wildfire smoke. And there's also other models when you're looking for things like if you're using it in a healthcare setting for protection from viruses. There are ones that have clear windows, so you can also service people with disabilities, such as those that are deaf and need to be able to communicate by reading lips. Mm-hmm. And because currently that was a big barrier for a lot of people with disabilities, and also for people with hearing disabilities as well. My mother's blind and she has a little bit of loss of her hearing, and she has trouble hearing. And when she had to go to the hospital during the pandemic, it was hard for her to be able to communicate with the doctors because it muffled the voice. And that's why there's also elastomeric respirators that have clear communication that remove that barrier as well. So it's not only able to better protect, it helps remove a lot of barriers different communities face as well.
And so, I appreciate you're probably still facing some pushback. How are you navigating that? And are you still sort of a bit shocked that you even are?
So with I'm absolutely shocked because a lot of this information has been known for decades. When it comes to infection prevention, the federal government and the Ontario government policies are that we have to continue to use surgical masks and cloth masks, but actively avoid using elastomeric respirators. And so I've been working with politicians, Elizabeth May behind the scenes for a few years, trying to push the ministers to acknowledge these protections exist, to remove misinformation in our policies saying things like we cannot filter out the gases from wildfire smoke, and that surgical masks are safe and effective, but elastomeric respirators are too dangerous to use. And the good thing is there are standards organizations that are the ones that are going to be creating these new next generation policies that will protect our frontline workers. ASTM, the committee I was presenting at last week, they meet every 6 months, typically in the US. This time it happened to be in Canada, to come up with new policies to better protect workers around the world. It's an international standards organization, and they're looking to change the policy so that wildland firefighters around the world, not just in Canada, but around the world, know to stop using N95s and know to start using elastomeric respirators. And there's also the CSA committee, or CSA group, that create workplace policies across Canada. So if you in a workplace that is hazards, you'll see you're required to wear CSA glasses. If there's a chance of falling somewhere, you have to wear CSA fall protection.
Yes.
If you have to if you're any province except Ontario, you have to have a CSA first aid kit. So the recommendations hold a lot of weight and pressure. And on June 20th, a couple days before the symposium, the CSA released their new draft for the next generation protections for healthcare settings. And it's huge leaps and bounds compared to what we saw during the pandemic. We're actually going to be following a model closer to what the US has been following for the last 3 decades. In healthcare settings, for example, they're getting rid of surgical masks. So no longer are healthcare workers or any worker going to be given a surgical mask. It's going to be banned to use that. Even when it comes to N95s, they're making a huge difference between surgical N95s and traditional N95s. So surgical N95 is one that has to be approved in addition to the CDC by the FDA or Health Canada, and it has to have additional protections from liquid. And so previously, you could use any type of N95, but the new policies are also going to make elastomeric respirators be put into widespread use. So not only does the CSA standard say that it should be put into widespread use, but it should also replace N95s in many scenarios, including for anybody who's looking at cost. If anybody's looking for the environmental aspect of respiratory protection, because there is a significant amount of environmental waste with N95s, and so they recommend it above it. And not only is it going to be healthcare workers getting these protections, it's anybody in the healthcare setting. So that means anybody providing cleaning services, even somebody transporting patients that are volunteering their time. And when the new CSA standards also acknowledge how viruses are transmitted. During the pandemic, we kept hearing 15 minutes and the 6-foot rule. And that was the assumption that you couldn't be infected unless you were within 6 foot of somebody who had the virus. Where we now know that the virus can stay suspended in the air. So even if somebody leaves a room and somebody walks into that room 2 hours later, if that virus is in the air, that person who walks in the room could still become infected. So the hazard could really be anywhere in the hospital. If an infected patient walks through a hallway, an elevator, the people traveling through those same areas could potentially be exposed if they're wearing anything short of a NIOSH-approved respirator. And even when it comes to patients, they realize surgical masks are not effective to keep patients from infecting healthcare workers, and they're going to be requiring that patients be giving respirators instead of surgical masks, and only be allowed to use a surgical mask if they're unable to wear a respirator due to problems with their medical conditions.
So what does this look like moving forward for you? How does this, you keep pushing this objective forward and creating that educational piece?
Well, I think once the CSA finally introduces these standards, the government is going to be forced to recognize that we did make a lot of mistakes during the pandemic. Right now, the government doesn't want to acknowledge a lot of mistakes that occurred. I don't blame them. A lot of people died because of the failures that we made. We made so many assumptions, and we also, instead of using the precautionary principle, which is use the highest levels of protection and only work our way down if the highest levels aren't available, we instead started from the bottom and kept at the bottom. We kept saying cloth masks are good enough, surgical masks are good enough. And even once the federal government acknowledged that the virus did linger in the air and that we needed tight-fitting respirators, federal employees such as Canada Post workers, if they were to wear an N95, they would get suspended, and they were told that they had to wear their Canada Post issued cloth mask. So there's going to be a lot of confusion when these new policies take root, but I think it's going to be a great opportunity because we can learn from where we made mistakes. We're going to learn that these solutions were already in use in the US. So we're going to learn to both things like the need to communicate with our partners in other countries, such as the United States and the CDC. It was such a weird feeling that everybody in the workplace was told to wear a NIOSH-approved N95, but then we had to completely ignore what NIOSH was recommending for respiratory protection, and the government was instead saying this protections NIOSH was recommending as the highest levels of protections were actually too dangerous to use under any circumstance. Also, it shows a need for communication between provinces, because when provinces like Alberta and BC are using these next generation respiratory protections for firefighters, and the federal government the Minister of Health is telling me that we can't even let the public know these solutions exist. We can't let the firefighting community know. We can't let other provinces know to look into these. Obviously, there's a huge disconnect happening. And I think that's why we need to get a lot of people in the room. There's not only a lack of communication between jurisdictions, there's a lack of communication within agencies. Few people know that during the pandemic, because Canadian manufacturers weren't able to get their new respirators approved by NIOSH, Health Canada started their own approval program for elastomeric respirators. And the one branch of Health Canada was approving them and sending them to provincial stockpiles, like a $35 million stockpile in Manitoba, a stockpile large enough to protect 100,000 healthcare workers in Ontario, 100,000 in Quebec. And these respirators stayed in warehouses because they didn't understand their potential. And when it comes to the other side of Health Canada, they were saying, we're afraid to even let the public know these solutions could be looked into or built upon. So even though we had these solutions, they sat unused and now they've expired. And that was another problem we learned from the pandemic. We learned in 2020 that the government needs to stay on top of their PPE stockpiles because we saw large amounts of N95 stockpiles expire, and the government promised they would never let stockpiles expire again. And they've done it within the pandemic. They purchased them in the spring of 2020, and now there's at least $50 million in elastomeric respirators that have expired, and we had the ability to eliminate N95 shortages for frontline workers in the summer of 2020.
Wow. That's a bit of a head shaker.
Yeah, absolutely. And one of the head shakers too is there's a few news articles, so the media would often not know how to report on it because they would be forced to rely on Health Canada for guidance and on the provinces for guidance. And if the government was saying it's too dangerous, that would be enough to stop the reporter from asking any questions because they assumed the government did their due diligence and researched this. And the problem is, there's also news articles, like one in February of 2021, where Ministry of Labor's had to visit hospitals experiencing deadly outbreaks, like Waypoint near Barrie, where the situation was so bad, the healthcare workers were begging for help on social media to get N95s for their hospitals. And the news investigation said that the Ministry of Labor went to investigate, and they had to tell the hospital to start using elastomeric respirators, and not only to start using them, but that using them would better protect their workers than the N95s. They explained it went well above and beyond the protections. So it confirms that the government knows that these are far better protections. But they also said it would eliminate the problems they were facing with N95 shortages. And this was 2021. It wasn't the spring of 2020. By this point, the stockpiles of the respirators the Ministry of Labor inspectors were recommending had been sitting unused in stockpiles for 8 months at that point.
Wow. So if folks wanted to find out more information, if they wanted to do a little bit of research, if they, I don't know if you interact with public, can they get a hold of you? What does that look like, Nick?
Well, the public can get a hold of me. I have a LinkedIn page where I share some of my work, my background as well. People could reach out to me there as well. I use Twitter as well, PPE to Heroes. That's another place people often reach out to me for help. Sometimes I have people from the public, but I've even had people with consultants for the Pentagon reach out for help so I could provide resources for the Department of Defense in the U.S. And really, I think the big takeaway is speak to your local MPs, speak to your local MPPs, ask the government to look at what the U.S. government's doing, look at what the CSA is about to do, because if we wait for the CSA to introduce these standards and the federal government hasn't updated that information by that point, then the public is going to be very confused because the CSA standards are going to be giving the public one
piece of information,
and the government's going to be telling them the complete opposite. So who do you rely on? Do you rely on the government, or do you rely on the standards organization and organizations such as the CDC, who have been recommending these respirators for infection prevention and wildfire since the 90s? And in fact, infection disease hospitals in the U.S. have been using elastomeric respirators to protect their healthcare workers since the 90s. And the CDC has been recommending them for every pandemic this century. This will be the first time that our own country actually acknowledges that they can be used.
Wow. So folks, again, if you want to get a hold of Nick, LinkedIn is probably the best way, or PPE for Heroes?
PPE to Heroes.
To Heroes. Like T0?
Yeah, if they Google...
pardon me.
If they Google Nicolas Smit Twitter, they'll find my Twitter profile as well. That might be easier. But I have open communication, so anybody can reach out to me if they want.
So Smit is SMIT. I know that Nick would love to, help to educate folks and certainly to get that messaging out. Thank you so much for taking the time for us. And it's a lot. It's a lot to unpack and a lot to kind of wrap your brain around. But I think education is power, and that's how we change things in the world. So thank you for doing what you're doing, and on behalf of someone who loves a firefighter. My son-in-law is a firefighter, so thank you very much for trying to make difference for them, because cases of cancer and health issues in the firefighting industry are certainly very significant. So we appreciate that. Thank you, Nick.
Absolutely. And I want to close with, it's not only going to be helping with the issues related to wildfire smoke and infection prevention when we introduce these recommendations, the healthcare system as a whole is collapsing because we don't have the resources to treat all these people now developing issues from the short and long-term exposure to wildfire smoke and even deadly viruses. We're seeing with measles, because we don't have the tools to prevent measles, we're seeing more measles in a week in Ontario than we saw as a country in a period of 10 years now.
Yeah, it's crazy. The world is a strange place, Nick. Again, folks, if you're interested in finding out more information or getting in touch with Nick, if you just search Nicolas Smit, S-M-I-T, you'll be able to find his LinkedIn page, of course, his Twitter account as well. And I know he'd love to engage with you. Again, it's an elastomeric respirator. You can pick them up if you're looking for some household use. Probably a great thing to be looking at versus an N95. Again, Nick, we appreciate you taking the time. Thank you so much.
And thank you for having me.